Hello friends, so we are back with the new topic and today's topic is deglutition. In simpler term, deglutition means swallowing of the food. So today we will be covering introduction of deglutition, components, theories of deglutition, its stages of deglutition, deglutition reflex and various applied physiology. So let's discuss deglutition in detail. So deglutition is coordinated activity of muscles of oral cavity, pharynx, larynx and esophagus. It is partly under voluntary control and partly is reflexive in nature. So basically deglutition involves three major muscles, oral cavity muscles like tongue, masticatory muscles like masseter, temporalis, lateral pterygoid and medial pterygoid. Then it involves pharyngeal muscles associated with the pharynx, and then the laryngeal muscles, the muscles associated with the larynx. So these three muscles are involved majorly in deglutition. These organs help in different stages of deglutition and makes the deglutition easier. So coming to the various theories associated with deglutition, first is oral expulsion theory. Oral expulsion theory stated that deglutition arises from the contraction of tongue and mylohyoid muscles which throws bolus into the stomach. So it basically involved expulsion of food from oral cavity to the stomach. Then second is the negative pressure theory, which stated that the tongue brought forward movement to create a negative pressure in the oral cavity, which is accentuated by descent of larynx, and therefore food is sucked into the esophagus. Then third is the integral function theory, which is the most accepted theory and stated that the act of swallowing is a dynamic process and it is based on the electromyographic results. So coming to the various phases of deglutition, we have majorly three phases like oral phase, pharyngeal phase and esophageal phase. We will discuss it one by one. So first is the oral phase. In oral phase, the food is prepared in the oral cavity. It is mixed with the saliva and moved into the oral cavity to the stomach. The tongue plays an important role during the oral phase because it also helps in the movement of bolus and rolling of food into a bolus like structure. Then it has two phases like oral preparatory phase and oral phase proper, and it is under voluntary control. So oral phase is the first phase of the deglutition in which the food is prepared in the oral cavity to move into the pharyngeal phase. So oral phase is the first phase which involves mastication. In mastication, the basic term for mastication is the chewing of the food. It is the programmed mandibular movement patterned in a sequence of distinctive recurring cycle. So we have basically three masticatory movement: first movement, second movement and third movement. First movement in which the mandible is lowered mainly by the gravity and there is contraction of the anterior belly of digastric, and the mandible is deviated to the non-working side. It helps in the opening of the mandible. The second is the closing movement in which the mandible is raised until the trapped food is felt, and then the mandible is swing swiftly and it is swing to the working side. In second mandibular movement, where there is closing of the mandible, there is contraction of the masseter muscle and the medial pterygoid muscle. Then the third movement is the power stroke, where the food is compressed, punctured, crushed and sheared, in which the teeth is meet in the lateral occlusion and slide into the centric relation. In third movement, there is contraction of the masseter muscles and the temporalis muscles. So the muscles associated with the swallowing is muscle of the tongue, muscle of the soft palate, which separates nasopharynx and the oropharynx, and third is the muscle of pharynx, which helps in the passage of bolus to the stomach. Now coming to the applied physiology of the oral phase, any injury to the hypoglossal nerve leads to the paralysis of the muscles of the tongue on the side of the lesion. Then second is the acute glossitis, in which there is inflammation of the tongue and the tongue fill the oral cavity and protrude out from the oral cavity. And third, in the unconscious patient, the tongue fall backward and there is entrapment of the airway passage. So the patient should be treated in the retroclined position. Coming to the preparatory phase, in which there is breaking down of food into the oral cavity. Food is chewed and mixed with the saliva, making into the bolus. There is elevator of the lower jaw, which plays an important role in bolus preparation. Then the salivary gland plays an important role in mixing of food into the bolus. The mucin present in the saliva holds the food, and then the salivary amylase present in the saliva, it digests the carbohydrates. Then the bicarbonate present in the salivary gland helps in maintaining the pH of the oral cavity, and the lysosome present in the saliva decrease the bacterial growth in the food or the bolus. So in preparatory phase, the food is prepared and there is formation of bolus, where there is transfer of food from oral cavity to the oropharyngeal surface of the tongue. There is accumulation on the oropharyngeal surface of the tongue due to repeated cycle of upward and downward movement of the tongue. Then coming to the oral phase proper, in which the bolus is moved towards the back of the tongue. There is contraction of the soft palate and prevent the nasal regurgitation. The soft palate prevents premature movement of bolus into the oropharynx. Once it is of suitable consistency, the transit food from mouth to oropharynx. So pharyngeal muscles plays an important role during this stage. It is reflexive and involuntary in nature. It takes second for bolus to transfer the pharynx and reach cricopharyngeal area. There is contraction of diaphragm is inhibited, making simultaneous breathing and swallowing impossible. In this phase, there is a sudden stoppage of breathing during the swallowing of the food, which is momentary. Here, the pharyngeal muscles are activated to propel the bolus into the esophagus. Any injury to the hypoglossal nerve leads to the paralysis of the muscles of the tongue on the side of the lesion. And in case of acute glossitis, there is inflammation of the tongue and the tongue fills the oral cavity and it protrudes out from the oral cavity. Then in case of unconscious patient, the tongue may fall back. So in this case, the patient should be placed in the supine or semi-reclined position. And the last is esophageal phase, which is reflexive and involuntary in nature. It relaxes the cricopharyngeal sphincter, and the duration of esophageal stage is 10 to 15 seconds. There is peristaltic contraction, which also helps during the swallowing. It can be primary, secondary and tertiary. Primary peristaltic contraction is a weak wave. It is controlled by deglutition center. The bolus reaches the upper part of esophagus and it propels food towards the stomach. Then the secondary peristaltic contraction is create positive pressure, and it is due to distension of the upper esophagus by bolus, and it is controlled locally by myenteric plexus by releasing the acetylcholine. Then the tertiary peristaltic contraction, in which there is irregular non-propulsive contraction involving the long segments. Peristaltic movement or the peristaltic contraction helps in the movement of food into the gastrointestinal tract. Now coming to the deglutition reflex, it is the beginning of the swallowing of the food. It is initially voluntary and later it is involuntary in nature. Now coming to the various applied physiology of the deglutition, we have different applied physiology like dysphagia, phagophagia, vomiting, deglutition apnea, aspiration, choking and gag reflex. We will discuss it one by one. So what is dysphagia? Dysphagia is difficulty in swallowing of the food. Then the vomiting, it is the expulsion of food and content from the esophagus or the stomach outside the oral cavity. It is different from the gag reflex, in which the food regurgitate into the oral cavity but not completely expelled out. Then deglutition apnea is momentary stoppage of breathing during the deglutition of food. Aspiration is movement of food from oral cavity to the nasal passage rather than into the GI tract. Then choking is the obstruction of food in between the nasal passage and the oral passage. This is the universal sign of choking. This was all about deglutition. Thank